All right, so we're going to show another way to do a tube tape here. So we're going to make, this is actually going to be a half. It's not going to go all the way around your patient's head. So we want to make sure where you're sort of going to anchor, make sure it's long enough, okay, to reach all the way across the other side. You can always make it longer than it needs to be, okay. So I'm going to start this back. Make sure you don't get into your patient's hair. It's not going to feel very comfortable. Okay, we're going to rip this into 3 even pieces. When you come across here, you want to make sure that you have the ability to keep this so that you don't get, especially if your patients have small upper lips here, that they don't have any tape pushing on their nose. So you may have to tab the tape a little bit to get this across. We're going to anchor the first strip that goes across. Okay, try and keep it as straight as you can and do it. Okay, we're going to rip the second piece in half. The patients that we would use this, why would we not wrap around somebody's head? So the patient population that we use this with primarily is our patients who have ICP issues. Okay, so if your patient is somebody who has an ICP issue, this is the tube tape that you should be doing. So sticky side around the tube itself. Okay, I'm gonna wrap around there. Again, this is way too long. Rip a piece of tape off, that's totally fine. Okay, make sure you put a tab on this as well. Okay. Oh my gosh, it's like I've never done this before. Okay, we're gonna wrap around again.
And that wrapping should be done opposite of the first one.
That I didn't do. I hate everything right now. I'm flustered doing this right now.
You're fine.
Not really.
Hold the tube.
You need to do that side or want me to do this?
Maybe. I can get myself loosening the tape.
The same thing, we're gonna rip another large piece of tape that goes across. This side, when you go across, you wanna make sure that it anchors kind of onto their face there.
You anchor with the first.
Anchor last.
That's what I thought. But you wrap with both.
Mm-hmm. So this, yep. Okay, always making sure you put your tabs on there, make it easy for the next person to be able to take the tape off. Okay, wrapping all the way around again.
That was just awful.
And then the final piece of tape, we're gonna tape over top of everything so we can secure the tube itself. And make it look pretty again. All right, any excess off. A little tabby on there. Beautiful. Okay, tube's not going anywhere.